All right, let's talk about the carnivore diet. You've seen it everywhere. It's that all-meat, zero-carb approach where suddenly steak is a health food and vegetables are, well, they're off the menu. But is there any real science to it? We're about to find out by going straight to an expert source.
So here's the big question, right? Is this whole thing a revolutionary health hack? Or is it just a dangerous fad waiting to blow up? You see headlines on one side saying it cures disease, and on the other, you see warnings about, scurvy and heart attacks. It's just a ton of noise. So to cut through it, we're going to look at someone who's spent decades researching this very thing. And that person is Dr. Eric Westman. Now, this isn't some influencer. This is an obesity medicine specialist at Duke University, a New York Times bestselling author. He's a clinical researcher who has spent the last 25 years in the trenches studying low-carb diets. And this is actually how it all began for him. He had 2 patients at a VA hospital who just dropped a ton of weight, over 50 pounds, and he had no idea why. When he asked them, one of them just looked him dead in the eye and said, "All I did is eat steak and eggs." And as a doctor trained in conventional medicine, he was just completely stunned. That single moment of shock kicked off a research career that's now spanned a quarter of a century, all looking into the very diet he was taught to fear.
Okay, so let's get right into the thick of it. Over the years, Dr. Westman has heard every single fear and criticism you can imagine. We're going to tackle the top 3 warnings you always hear about a meat-only diet and see how he answers them based on his actual clinical experience.
First up, the old pirate disease, scurvy. I mean, it makes sense on the surface, right? The claim is simple. Meat has barely any vitamin C, so if you're not eating fruits and veggies, you're obviously heading straight for a deficiency. This is probably one of the most common attacks you'll hear. But Dr. Westman's rebuttal is pretty direct, and it comes from those 25 years of practice. He says he has never, ever seen a single case of scurvy. Now, the theory he points to is that vitamin C and glucose, that's sugar, actually compete for the same ride into your cells. So, the argument goes, when you get rid of all that sugar, your body's demand for vitamin C might just plummet, meaning the tiny amount you do get from meat could actually be enough.
Okay, here it is, the big one. For 50 years, we have been told that red meat and all its saturated fat will clog your arteries by jacking up your cholesterol. I mean, that fear is practically baked into our collective consciousness. So what's the real story here?
Well, to explain this, Dr. Westman uses a really great analogy. He says focusing only on LDL cholesterol is like using an old-school phone with a cord. It's just outdated tech. The new paradigm, the smartphone of cholesterol, if you will, looks at a much more detailed picture. It zeroes in on the ratio of your triglycerides to your HDL, your good cholesterol, and it sees reversing things like diabetes as way more important for your risk than just that one LDL number. And this chart basically shows the pattern he sees all the time in his clinic. On a low-carb diet, you'll often see triglycerides just plummet, while HDL, the good stuff, goes up. So yeah, sometimes LDL might go up a little, but he argues the context is what really matters. It's the whole pattern that tells the story, not just one isolated number.
All right, the third common fear, that hitting your body with so much protein from all that meat is going to put a massive strain on your kidneys and eventually cause serious damage. And that sounds pretty plausible. So what's the rebuttal?
He flat out calls it a myth. He points to research on his own patients which found that a high-protein, low-carb diet didn't make their kidney function worse. But here's the real kicker. For so many people, the #1 thing causing kidney disease in the first place is type 2 diabetes. So he argues, if the diet actually reverses the diabetes, you're not hurting your kidneys, you're fixing the root cause of the problem. You might even improve their function.
So, if scurvy, high cholesterol, and kidney damage aren't the main dangers, at least according to Dr. Westman, then what is? This is where his perspective as a doctor who actually treats patients really shines through. And it's probably not what you're thinking. He says the real danger isn't the food, it's the medication. Just think about it for a second. If you're on a diet that's so powerful it dramatically lowers your blood sugar or your blood pressure, but you keep taking the full dose of your medication, that medicine can suddenly become way too strong. It can cause a dangerous crash. The key takeaway here is that a diet this potent absolutely requires careful medical supervision to safely lower or get off those medications. So, how does a doctor get anyone to actually stick with something that sounds so restrictive? This is where we get out of the theory and into the real world. And Dr. Westman's approach, it's surprisingly down to earth. It's all about progress, not perfection. He boils it down to these 3 simple steps. First, focus on the big thing, the heavy hitter, keeping your carbs super low. Second, don't sweat the small stuff. Don't get lost in the weeds worrying about whether it's grass-fed beef or regular ground beef or what kind of oil you're using. Those are tiny details compared to the carbs. And third, and this is the most important, the real goal is just sticking with it. A quote, perfect diet you quit after 3 days is totally useless. And this story he tells just perfectly illustrates that point. He had a patient come to him and say, "Doc, I couldn't find any grass-fed beef, so I just gave up and went to McDonald's and ate a burger with the bun." And his reaction was, no, just go to McDonald's, get the burger, and throw the bun in the trash, because the bun is the real problem. It's a really potent example of just focusing on the biggest win to make the diet work in the real world.
And it seems like that simple philosophy gets results. I mean, to put a number on his point about cholesterol, Dr. Westman estimates from his own practice that for about 2/3 of the people who eat this way, their entire cholesterol pattern, that new paradigm we talked about, actually gets better. So, after all this, what's the big takeaway? Well, from Dr. Westman's perspective, a lot of the fear we have around meat comes from what he considers pretty weak science. You know, those studies that only show an association, not that one thing caused another. Or, and this is so important, it comes from studying meat being eaten as part of a high-carb diet, which is a totally different metabolic ballgame.
And that kind of leaves us with one last big question to chew on. Looking at it from this angle, is the biggest health risk we face really the food on our plate? Or could it be the scientific lens we've been using to judge that food all along? Something to think about. Thanks for tuning in.